كيف لهنا ما اقدرش اعمله كده. My talk will be about contrast enhanced mammography. Breast cancer remains the most commonly diagnosed cancer in female, with the mortality rate have been grossly reduced with the use of screening mammography. However, screening mammography is associated with reduced sensitivity in female with dense breasts. To resolve this issue, many adjoining techniques, including ultrasound and MRI, have been used. Contrast-enhanced mammography is an emerging modality that was commercially introduced since the year of 2011. It used the combination of dual energy imaging and intravenous administration of IB contrast material to visualize the breast new vascularity in a fashion similar to MRI. It can be performed by using a dual energy, by using a standard mammographic equipment to visualize the breast vascularity, and this modality have been improved to perform the dual energy imaging. It consists of low energy imaging, high energy imaging, and the recombined imaging. The low energy imaging uses the kilovoltage below that of the iodine. The contrast material is not depicted, and the images are similar to standard mammography. The high energy imaging reveals contrast uptake and is non-informative. ما فيش point. يعني لو تعمل هذا اللي في الوسط ضعيف. And this is the recombined images. It forms of subtraction of the low from the high energy imaging and highlights area of contrast uptake only. The exam is done by injecting intravenous low osmolar contrast material in a dose of 3 milli per second and a rate of a dose 1.5 milli per kg and the rate 3 milli per second. The breast, after 2 minutes, the breast is compressed and as a quick succession of craniocaudal and mediolateral oblique views are taken. Both low energy and high energy imaging are taken. The duration of exam is between 5 to 8 minutes. After completion of the exam, additional images may be taken. Currently, there is no BI-RADS data system for contrast enhanced mammography, and in the meantime, for the low energy, we use the BI-RADS mammographic data system, and for the recombined imaging, we use the MRI reporting data system. We start the interpretation by using the low energy imaging to detect any morphological abnormality, and management should be made based on both sets of exams. There are many uses for contrast enhanced mammography. Among the commonest use, it is a problem solving tool in cases of inconclusive findings on screening mammography. It's used in a female who are recently diagnosed with breast cancer for staging, and it can be used as a screening tool in intermediate and high-risk patients, and used to monitor the response of chemotherapy in female with breast cancer. The most common inconclusive findings on screening mammography include masses, architectural distortion, and microcalcification. Regarding the masses, contrast-enhanced mammography is used to identify any morphological abnormality, enhancement pattern, and identify any additional abnormality on the same or in the contralateral breast. There are many masses on contrast-enhanced mammography, either benign or malignant, can present as an enhancing mass, and this reduces the specificity of this modality. This is an example of breast cysts. And on this image, this is mediolateral oblique view, recombined contrast-enhanced mammography, and this is MRI with contrast. Look how they look similar to each other. And these are multiple masses, non-enhancing. Some shows peripheral enhancement, and the largest with a thick enhancing wall, and this was infected cyst. Among the commonest enhanced benign masses are fibroadenomas, papilloma, and inflammatory masses. This is a young female presented with a mass. It looks well-defined, homogeneous, and on the recombined view, it shows homogeneous enhancement, and findings were of fibroadenoma and confirmed by histopathology. Another female presented with a irregular mass. The above images are the low energy imaging, and the low are the recombined images. The mass is irregular and shows heterogeneous nodular enhancement. Findings were suspicious for malignancy. Biopsy confirmed invasive ductal carcinoma. Generally speaking, masses with irregular border, non-circumscribed borders with heterogeneous internal enhancement are the highest for malignancy. Red flag, any suspicious mass, whether it is enhanced or non-enhanced, biopsy should be performed, as low-grade malignancy can be presented as non-enhancing mass. Architectural distortion may be due to a benign or malignant causes. Absence of enhancement in contrast-enhanced mammography has the highest production of benignicity. This is a female presenting with architectural distortion and was suspicious. Recombined imaging shows that at the site of architectural distortion, there was an enhancing mass, and suggestion was of an aggressive lesion, and biopsy confirmed the diagnosis. Generally speaking, as in 2/3 of cases of architectural distortion may be associated with malignancy, so whether there is enhancement or no, biopsy should be performed in these cases. Suspicious microcalcification may be a manifestation of ductal carcinoma in situ. So, contrast-enhanced mammography has advantage over MRI in detection of this calcification, which is not possible in MRI. It also may show any occult masses and associated enhancement, and also increase the accuracy of targeting the biopsy site. This is a female presented with suspicious microcalcification. Low energy imaging and magnified imaging shows that there is calcification in the right lateral breast. The recombined imaging at the site of microcalcification showed no masses, no enhancement. However, there was an enhancing mass, small with irregular borders, and biopsy from this mass and tissue sampling from the microcalcification confirmed invasive ductal carcinoma. The last flag, regardless of the presence of enhancement, microcalcification with intermediate or a malignant feature should undergo tissue sampling. As I mentioned, contrast-enhanced mammography can be used in cases of female diagnosed with breast cancer for staging. It determines the extent of the disease, detection of any additional site in the same breast or contralateral, and is accurate in determining the size of the tumor. This is a female with a breast mass on the right side. Left breast showed no masses. On the recombined images, there was enhancement on this mass, and surprisingly, there was another mass on the left breast. The patient underwent mammography, underwent MRI, and there was masses on both breasts. تقريباً خلصت شوية. It's also useful for following up patient with chemotherapy to evaluate the response of treatment and to determine the residual tumor after treatment. This is a female with proved malignancy. The above imaging shows irregular mass with heterogeneous enhancement, and there was a reduction in the size of the tumor when the patient underwent chemotherapy. And after completion of the chemotherapy, the mass completely disappeared and confirmed by histopathology. This exam is contraindicated in pregnancy, in cases of hypersensitivity to contrast material, and in renal insufficiency. The disadvantage of this technique is increased radiation dose. It is subject to patient motion due to the long acquisition time, and it may produce artifacts. In conclusion, contrast enhanced mammography is an emerging, promising new modality that is used for breast imaging and cancer detection. Of low cost and easy to perform in everyday clinic, providing a critical information in different clinical scenarios.